arteries coming out from the same place. Typically, the left coronary artery comes out over here. In this case, we have a variant where they're both coming out from the same place, and this potentially could cause chest pain and potential sudden death, especially in young people. Again, this is just a 3D reconstruction of the same anomaly. Here's just another 3D reconstruction of anomalous coronary arteries. We can see the axial anatomy of the heart. We can evaluate not only the coronary arteries, but we can also evaluate the chambers of the heart, such as the left ventricle, the right ventricle, left atrium, and right atrium. We can also evaluate the valves, in this case the mitral valve. And we can also do moving pictures of the heart, where we can actually evaluate the motion of the muscle of the heart, which many times we're able to determine if the patient has had a significant heart attack with damage to the muscle, or maybe there's just ischemia to the muscle, especially when the patient is stressed. Other things that we can image with cardiac CT now is not just the heart, it's everything else around it. We can also evaluate the pulmonary arteries. In this case, we see this little gray filling defect in one of the pulmonary arteries, which is an embolus. Typically, these come from venous thrombosis in the legs or the pelvis, which travel all the way up to the lungs, and they lodge themselves in the pulmonary arteries and can mask themselves as chest pain or shortness of breath. So a lot of times we actually find ourselves finding these things when actually we're doing the case for a cardiac reason. We actually find that there's other disease. Other examples that might cause chest pain are pulmonary nodules, enlarged lymph nodes, pleural effusions, and all these things we can evaluate with the non-invasive cardiac CT. This is just an example of a non-contrast enhanced image and contrast enhanced image, and again you see the white calcified plaque all over the coronary artery, but just by looking at this image we can't tell where the disease is. So after injecting the contrast, we can actually see that there's a little bit of narrowing here in the coronary artery. Now the reason I show this image is because even though it's not significant narrowing, by doing this study we've identified a potential lesion that eventually over several years can get worse. So once we are able to identify this, we know that the patient is at risk, and now we certainly can talk to the patient and let them know with these images that it's time to start getting to taking care of yourself, eating better, doing more exercise, and obviously prevent this getting worse. This is just a axial image of the heart showing this right coronary artery. And what we've been able to do now with CT is something that we've never been able to do before, is actually evaluate the composition of the atherosclerotic plaque causing the luminal stenosis. Here I'm going to zoom up that image, and here you can see that there's contrast filling the artery. However, it is narrow because there is this big plaque right here causing the stenosis. Now, if you look a little bit closer, there's a little bit of a darker spot within the plaque. This darker spot is actually the bad part of the plaque, which is composed of fat. This is the risky lesion, which may actually rupture and cause acute coronary artery syndrome or acute heart attack. And this is the type of lesion that we want to find and make sure that we treat that quickly. Unfortunately, this patient passed away. I'm not sure if it was because of this lesion. I would think not, but we were able to obtain a histologic comparison of this lesion, and here you can see the composition of fat of that plaque. And what happens is essentially this can rupture into the coronary artery and cause an occlusion or a thrombus and eventual heart attack. But the main thing is that nowadays we are able to evaluate that plaque. We can tell if it's calcified, non-calcified, if it's fatty or fibrous, and that way we can help the cardiologist in determining how aggressive they should be in treating their patient. This is just a correlation of CT with ultrasound.